Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS. Postgraduate Diploma in Hospital and Health Management, PGDHHM, revised. MHH 102 Hospital Services. Volume 1. Block 1 Clinical Services I. Unit 1 Outpatient Services, 1.0 Objectives. After going through this unit, you will be able to discuss the roles, functions, and types of outpatient services. Describe the physical facilities layout, equipment, and staffing requirements in planning of outpatient services. Describe a plan for monitoring and evaluation of outpatient services and tackle the challenges efficiently for providing satisfactory services to the patients. 1.1 Introduction. You will agree that the hospital is an integral part of the society as it serves the most important purpose of providing preventive health services, diagnosis, treatment, and rehabilitative care to the patients. The first interaction between the patient and hospital. Staff in a hospital is either outpatient department, OPD, or the emergency department. The hospital outpatient department has attracted increasing attention in recent years, as many diseases can now be diagnosed, treated, and even operated upon as an outpatient procedure basis. This results in less expenses for the patients and hospital, resulting in efficient utilization of hospitals' beds, which are more expensive only for those genuine patients who need inpatient care. In this unit you will learn and understand, in a systematic approach, about the functions, planning of services, staffing and an effective management of outpatient department. 1.2 Importance. The importance of the outpatient department in a hospital setting could be summarized as the patient's first point of contact with the hospital and entry point into the healthcare delivery system, an inseparable link in the hierarchical chain of healthcare facilities, contributor to reduction in morbidity and mortality, a stepping stone for health promotion and disease prevention, helps to reduce the number of admissions to inpatient wards, thus conserving scarce beds, acts as a filter for inpatient admissions, ensuring that only those patients are admitted who are most likely to benefit from such care. For a hospital as whole, outpatient services should project its efficiency and a good public relation image. All the patients, except the emergency patient, coming to casualty OPD, it is the first point of contact with the hospital. It is this first impression which can make or break the reputation of a hospital. That is why it is also called the show window of a hospital. 1.3 Functions and Types. With the passage of time, the functions of OPD, which earlier was supposed to provide curative healthcare only, has expanded manifold and is expected to provide a wide scope of services including promotive, preventive, and rehabilitative services. These services are irrespective of the size or the type of the hospital, be it in voluntary government or in a private sector. 1.3.1 Role and Functions. Outpatient department is one of the departments of the hospital which cares for the ambulatory patient who come for diagnosis, treatment and follow-up. You must have observed that the roles and functions of outpatient services have gradually widened over the years. Now, the role and functions of outpatient services include A. To treat on ambulatory and domiciliary basis all cases this can be treated in the outpatient department. B. To conduct preventive and promotive services through provision of immunization, screening OPDs, antenatal, well baby, counseling, family welfare clinics etc. C. To provide for the community a major source of specialist diagnostic medical opinion where the knowledge, skills and resources of the specialist are backed up by the resources of the hospital. These include not only the physical resources but also the presence of a wide range of other specialists which facilitates early referral when necessary and of supportive allied health professions. D. To refer patients for admission to the hospital of those who need it. A. To conduct aftercare and medical rehabilitation, when necessary, after discharge from hospital. F. To promote health of the individuals under care in the outpatient department, by means of health education. G. To train medical students, house physicians and other professional staff such as nurses and technicians with valuable and diversified clinical experiences. H. To compile, collate and analyze records of patients using outpatient services for epidemiological, social clinical research and for periodic assessment of clinical outcomes. I. Act as epidemiological surveillance center for many diseases e.g. all district hospitals act as sentinel center for vaccine preventable diseases. Patients visiting outpatient department can be broadly grouped in 3 categories. A. General outpatient. Most of the patients visiting government hospital are of this category. They are those patients who are given diagnostic or therapeutic services on an outpatient basis other than emergency condition, and who was not referred for such services by his attending physician. Such patients come to the department on their own and usually known as walk-in patients. It is possible that majority of those patients who are coming from the adjoining areas are of this category, and most of them come from minor ailments. B. Referred outpatient. They are those patients who have been referred to the concerned OPD by their treating physician for specific diagnostic or therapeutic procedures other than an emergency condition, and who will in all probability return to the referring physician for future care. In a health system where organized referral system is in force, most of the patients visiting a tertiary or apex super specialty institutions for specialized clinics fall under this category. C. Emergency outpatient. These are the patients who are visiting the emergency or casualty department for relief and treatment of acute illness. Outpatient visit. This is arrival of a patient at the outpatient department of the hospital to receive the services provided therein. There are two types of visits. 1. New outpatient visit. The arrival of a patient to avail the services of outpatient department for the first time. They are also known as new cases or new patient. 2. Repeat outpatient visit. An outpatient visit by a patient subsequent to a new outpatient visit. 1.3.2 Types. Outpatient services could be of two types. I. Centralized outpatient services. In centralized outpatient services, all the outpatient care relating to all the specialties are provided in a compact area, which includes all diagnostic and therapeutic facilities. Polyclinics in various hospitals is based on this concept. E. Decentralized outpatient services. In decentralized outpatient service, the outpatient care is provided in the respective clinical departments. The same holds true for diagnostic and therapeutic services also. The specialty clinics are usually based on this concept. Use of one type of outpatient service in a particular hospital depends on the size, variety and workload of the hospital. Larger the hospital, more centralized are the outpatient services. This also leads to economy as well as higher patient satisfaction. 1.4 Planning considerations. While planning, the approximate patient load expected in the hospital must be defined. The patient load is said to be dependent grossly on the following characteristics. A. Needs of the population, type, and number of healthcare institutions available in the adjoining areas. B. Number of cases expected to be referred from other institutions or private physicians. However, this is not true for the tertiary care institutions providing specialty services. C. Reputation of the hospital. D. Nature of services to be provided by the hospital, like super specialty care of the selected medical disciplines. A. Type of hospital, like if it is a government hospital expecting to serve the whole population of the adjoining areas or of the whole state, or a charity hospital. Private hospital, hospital serving only the employees, and so on. In view of this, OPD's patients number is not fixed. A rough estimate is 5 to 6 patients. Bed with 50% new patients and 50% follow-up cases. 1.4.1 Physical facilities and layout. Location. Location of the OPD block. The OPD block should be so located that it is conveniently accessible for patients coming by public transport or their own vehicle, and therefore should be towards the front of the hospital and provided with its own car parking area. The location should be such that it is close to facilities such as registration desk, laboratory, radiology, pharmacy, social services etc., which would also be utilized for the indoor patients. The OPD block should be incorporated in the main building of hospital complex, and each unit should be linked with the relevant ward. However, the patient flow should be so designed that the OPD patients' traffic should not pass through indoor areas or disturb the inpatients while going in and out from the OPD into the common service areas. Principles of planning layout. The following principles should be kept in view while planning layout of the OPD services. It should be ensured that patient flow moves in one direction, in logical sequence, and there is no undue back traffic. It should be able to share with the inpatient departments all diagnostic facilities, such as X-ray and pathology laboratory. It should be amenable to expansion without serious dislocation of work. Layout. Various designs or layouts can be used, such as the double-loaded single corridor with rooms on each side of the corridor, the double corridor for entry from the opposite sides of the room, the triple corridor which provides 2 rooms of examination treatment rooms on each side of a staff corridor. Size. Bureau of Indian Standards has recommended the following space provisions for various zones: 2 square meters per bed for entrance zone, 10 square meters per bed for the ambulatory zone, and 6 square meters per bed for diagnostic zone out of a total of 60 square meters per bed for the total hospital area. Physical facilities. The physical facilities may be considered under 4 groups. A. Public areas, entrance zone. B. Clinical areas, ambulatory zone and diagnostic zone. C. Administrative areas, D-circulation areas. Public areas. I. Entrance. It should be easily accessible, with wide door and have ramps and slopes. E. Reception and information, a desk or a counter located within the public area for information and reception. E. Registration and records area. This area should be located near the entrance. Railings should be provided for separate queues, new and old, male and female patients. A counter 300 cm high and with work surface 60 cm wide and with file drawers is necessary. One desk should be provided for 20 patients per hour. 2 square meters per bed should be provided for outpatient records. IV. Waiting area. Main waiting area should be adjacent to registration area, and sub-waiting area should be provided in each clinical department. Waiting area is provided at the scale of 0.1 square meter per patient, with a minimum of 4 square meter. The area provided in sub-waiting areas adjacent to various consultation, diagnostic and therapy areas is 0.8 square meter per patient. V. Public toilets and washrooms, for males and females at the scale of 1 for each 200 patients and visitors should be provided. V. Drinking water. Arrangement for drinking water from a water cooler with a dispenser should also to be provided to patient and their attendants. V. Snack bar. It should be located convenient to the main waiting area. It should be maintained in a hygienic manner. V. Parking area. It should be near the main gate but encroaching it. Clinical areas. An OPD includes surgical, dental, ophthalmic, ENT, obstetric and gynecological, pediatric, medical, psychiatric, dermatology and venereology, orthopedic and emergency departments. Depending upon the type of hospital, there may be super specialty clinics such as cardiology, neurology, and urology, to mention a few only. In addition, there are ancillary facilities like treatment sections including minor operations, injection, dressing and dispensary. There are auxiliary services like pathology, blood bank and radiology. There is also a growing need for instituting health education program to educate the public in environmental hygiene, family welfare etc. General requirements for the above clinics are as follows. A. Sub-waiting area. This area should not have more than 1/3 of the total number of patients visiting the clinic in a day. B. Consultation room. This room should provide for accommodation for a doctor's chair, table, patient's stool, follower's seat, wash basin, examination couch and equipment for examination. Area should be about 15 to 17 sq.mt. Each clinic should be able to manage 100 cases per day. C. Special examination room. Certain departments will need separate room for special examinations depending upon the type of equipment being used in the OPD. D. Polyclinic. A polyclinic may be defined as a clinical establishment providing examination, consultation, prescription to outpatients including dispensing of medicines by more than one doctor or general practitioners, or specialist doctors or super specialist doctors. In polyclinic, all the specialty care clinics are there at one OPD area, with various clinics running at different places and time. Ancillary facilities. I. Injection room. It should have a waiting area for about 10 to 20 patients at the rate of 0.8 square meter per patient. The area may vary from 12 to 40 square meter depending on the workload. E. Treatment and dressing room. About 12 to 16 sq.mt shall be required for each treatment and dressing room. E. Pharmacy. The waiting area should be comfortable in the pharmacy as the patients are quite tired when they reach this place. The accommodation should be sufficient to contain about 5% of total clinical visits to the OPD. In one session, pharmacy will require multiple dispensing windows, compounding counters with sink, drug storage cabinet and shelves, the details of which you will learn in Unit 4 of Block 3 of this course. Auxiliary facilities. I. Laboratory. It should be able to serve both inpatient and outpatients. A. Sample collecting station for urine, stool and blood specimens should be provided separately in the OPD. It should have 2, male and female, washrooms and toilets, 15 square meter, and a bleeding room, 15 to 20 square meter, with 2 or more examination tables. You will learn more details of planning and organization of laboratory services in Unit 1 of Block 3 of this course. Radiology. It should be able to serve both inpatients as well as outpatients, the details of which have been described in Unit 2 of Block 3 this course. Blood bank. This will include a reception cum waiting area, bleeding room, laboratory for grouping, recovery room, and a room for storage of blood. The ancillaries like washing and sterilization room, office room, and toilet facilities need to be provided. The details of planning and organization of blood bank services of a hospital have been discussed in Unit 3 of Block 3 of this course. IV, health education facility. This should include an office for the health educator, conference and lecture room, and space all over the OPD for display of educational material. Minimum area required for this facility would be 15 square meter. Audio-visual aids such as TV, video player and health education cassettes should be made available in this area. Medical social service facility. This facility should be located in the OPD, with suitable cubicle for each social worker, counselor to provide privacy. Screening clinic. This is specially required in a teaching, tertiary hospital. It should be located near the registration area. It should consist of 1 or more cubicles with examination table, stool, table, and chair with 12 sq meter for each cubicle. This reduces the workload on the specialty clinic and also increases quality of specialty services. Preventive and promotive health facility. An office of size 15 square meter is the minimum requirement for this facility. This facility provides advice on sanitation, control of communicable diseases, nutrition, home care, public health, nursing, mental health, occupational hazards, immunization, family welfare, counseling, well baby and well adult clinics in addition to morbidity studies. Administrative areas. Administrative office. A room of 15 square meter for a hospital with 100 beds or more is required to function for administrator's office. Business office. The office for personnel section, requisitions, making reports, etc. is required in OPD area in large and active OPD. Housekeeping. A janitor's closet for housekeeping and cleansing materials is required with a size of 4 square meters. Storage facilities. General stores. It should be with the general stores area of the OPD. Drug stores. Pharmacy stores should be in the hospital at a central place. Linen stores. Each floor of OPD area will require a closet with shelves for storage of daily supplies of linen. An area of 2 square meter may be sufficient. Circulation areas. This includes corridors, stairs, lifts, etc. This occupies about 30% of the total building area. Elevators should be easily accessible, especially for cardiac and obstetric patients. Corridors should be at least 1.8 meters wide. Security posts should be provided at strategic locations. STD, ISD phone facility also should be made available. 1.4.2 Equipment. Equipment as related to the specialty examination should be available in the concerned room. Sufficient numbers of wheelchairs and stretchers in a conveniently accessible location should be made available. Each consultation cum examination room should have a work table, physician's desk, wall-mounted cabinets, X-ray view box, revolving stools and chairs besides examination couch, wash basin, instrument trolley. All OPDs should have equipment for resuscitation of patient collapsing suddenly. 1.4.3 Staffing. Staffing pattern for the outpatient services will be dependent on analysis of the objectives of the department and on the volume of the workload in each of its functional areas. There should be no separation of medical staff into inpatient and outpatient staff so as to ensure continuity of patient care. The nursing staff consisting of registered nurses, ANMs and nursing or hospital aides in sufficient number should be provided in the OPD. Ancillary staff in OPD e.g., X-ray, laboratory, EEG and ECG technicians are required. The clerical staffs conduct registration, patients billing, cashiering, secretarial and medical record functions. In teaching hospitals, senior physicians have interns and residents, assisting them in professional care of patients. Some hospitals use volunteers in a variety of activities in the outpatient services. In a large hospital, the outpatient department will require an administrator for planning, organizing, supervising, coordinating, evaluating. To improve the outpatient services, receptionists, who make the first contact with all people, are important members of outpatient staff. 1.5 Organization and Managerial Considerations. 1.5.1 Policy. The policy in the outpatient services should be to achieve continuity of high quality patient care with modern techniques and methods in order to have total patient satisfaction at all times with the willing cooperation of all the healthcare personnel working in the outpatient department as well as inpatient departments. 1.5.2 Procedures. There should be a manual of procedures to be followed by all healthcare personnel working in the outpatient services. All the healthcare personnel should be trained and retrained in conducting all or any procedure related to their work area. All the procedures conducted in the outpatient department should be carefully recorded and documented in a retrievable format so that the patients can be benefited in future, as outcome of treatment could be scientifically evaluated. It is better to implement appointment system to spread out the reporting time of patients. It can be either individual or block appointments. The block appointment system calls for a certain number of patients to be present at a given time so as to provide a sufficient pool of patient, and thus the physician will at no time find himself idle. It limits the pool to the capacity of the waiting room. Information, graphics and signage system, name boards, pictorial representation of services provided, direction signs, color coding of different service areas facilitate easy understanding of hospital procedures and services by the patients. 1.5.3 Managerial Considerations. Public Relations. For many members of the community, the OPD will be their first point of contact with the hospital. Ideally, therefore, it should be something of a showpiece, making evident from the warmth and humanity of the hospital, its respect for the patient and his dignity, provision of the proper setting for good clinical care, and good administration. Many of these things, the patient can judge for himself, and they may influence unduly his future opinions of the hospital. All efforts must be made that the patients get a positive impression in the OPD. Overcrowding and long waiting time. Many hospitals face the problem of overcrowding and long waiting time. Due to various reasons, patient after initial waiting for registration, waits for consultations, diagnostics, and treatment, or even for collection of medicines at pharmacy. Adequate attention by all hospital administrations must be given to resolve this problem. A simple random study of waiting patterns since the arrival of patients through his final disposal and reasons thereof must be conducted, and bottlenecks removed. The queuing theory which has been dealt in Unit 1 of Block 4 of this course can be applied to resolve the problem. OPD timings. The timings should be decided to suit the local and organizational needs. General OPDs with basic specialties are usually conducted 6 days in a week, maybe from 08:00 hours to 13:00 hours or so. The timing for the registration of new and old cases may be separated to avoid congestion. All registered patients must be seen irrespective of the timings fixed for OPDs. Timings for ancillary, supportive facilities must be kept at least 1 hour after the OPD timings so that no patient who has been seen in the OPD is denied the treatment, investigation, or drugs. It also must be ensured by the administrator that the timings for OPD are rigidly followed. Increase in registration time, adequate number of doctors, separate queue for new or old cases may help in reducing waiting time in registration. Screening clinics help in disposal of patients with minor illnesses, thus leading to less crowding and waiting time in specialty clinics. Special clinics at different timings, especially during afternoon hours, e.g., well baby clinic, diabetes clinic, leprosy, TB, follow-up, super specialty clinics etc. also prevent overcrowding. Increasing the duration of OPD services or operating evening OPD services can also prevent overcrowding. Synchronizing functioning of ancillary facilities with OPD workload so that the laboratory, radiology and pharmacy are open and adequately staffed during peak hours. These departments should remain open for a longer duration as compared to OPD. The patient's records of indoor and outdoor services, investigations and treatment should be available in an easily retrievable form at each visit by the patient. Direction for patient's movement. A layout map of diagrammatic scheme for various OPD facilities should prominently be exhibited at the entrance of the hospital. B. Signage boards at all the strategic location about the hospital service areas will help the patients, as well as create a good public relation image of the hospital. C. Working hours, days and holidays should also be displayed clearly on notice board. D. Name of medical specialists should always be available in front of the consulting room. Provision of changing the nameplate, depending on who is present on a particular date, be made and followed. Adequate number of wheelchairs, patient trolleys should be made available. No of such trolley and wheelchair will depend on no of OPD attendance and type of specialty services like orthopedics, neurological and so on. Number of benches, chairs in each waiting and sub-waiting area of the OPD and may be made a permanent fixture of the area. A OPD booklet may be made available to patients, which contains all vital information about the OPD services. F. The officer in charge should be encouraged to take round at least once in the morning to see that everything is going on well as planned, and subsequent administrative round should also be made at peak period to see whether some more help or guidance is required or not. Registration, reception inquiry, cash counter of the OPD. The number of such counters in the OPD depends upon the number of patients coming to OPD, types of OPD clinics functioning on particular days and the size and physical layout of the hospital. However, it should be ensured that separate counters are created for male and female patients for registration and cash deposit. It is to be seen that in no circumstances registration and payment of cash for the service should take more than 10 to 15 minutes in any hospital situation. After registration, patients should normally be examined on the basis of first come first serve basis, except in emergency or when there is a prior appointment. Working rules for OPDs. Following are few important working rules which can be followed for the operational efficiency in the OPD. A. The patients treated in the OPD are usually ambulatory and with minor ailments, so all acute or seriously ill patients must not be referred to the OPD. They should be managed in the casualty or in emergency department only. B. Registration. A patient should be eligible for obtaining medical help in OPD only after getting registered as per the hospital procedure. C. Days. The OPD days of the clinical unit or the name of unit officer and specialties should be pre-stamped on the OPD card and laboratory investigation forms of the respective OPD days for operational efficiency. A. The OPD consultation system should be so organized that there should be continuity in treatment and patient on revisit can go to the same clinical doctor without any difficulty. The clinical protocol of the hospital is so designed that the investigation conducted, diagnosis of the sickness and treatment given can be used for future reference of the patient. B. All patients should be given identification and appointment card, clinical care advice card complete in all respect for undergoing investigations and appointment with the referred doctor if any. C. Investigation forms must clearly indicate the name of the doctors or at least the name of the clinic unit or specialty department who has initiated or requisitioned the investigation. It should have registration number, charges paid and signature of doctor who fulfilled the forms. D. Provision of centralized specimen collection center will ensure that patients can give all of his specimens for test easily at one place, be guided, directed. 2. After collection of samples, the specimen can be sent to various laboratories for test and the reports should be sent either directly to various OPD or to central collection point from where they are redistributed. A. Special test. In all case, where appointments for special tests are required, patients may be directed to report to respective sections, e.g. for IVP or barium meal or radioiodine test or ultrasound etc., where patient can get the specific time, date, and special instruction. Due payment also should be received in advance so that there may not be any delay on the specified date of the test. Referrals and cross-referral to other specialty. The patients needing multiple consultation or for obtaining the opinion of other specialties to diagnose the exact problem for which the patient is being referred must be written down on the referral slip and accordingly the patient be directed to the concerned OPD. Usually, there should be no insistence for re-registration of the patient in the same outpatient department where he or she is being referred. While referring the case to other specialty, it is always advisable to send the report or result on the investigation done and the list of investigations requested for the patient so that repetition of the investigation is avoided, thus valuable time, money, and effort of laboratory can be saved. Method of admitting patient from OPD. The patient requiring admission to the ward for further investigation, treatment and management should be done from OPD directly. However, it is always advisable to confirm from admission office about the vacant bed position in the ward. Only after doing so, the patient should be referred to admission office for admission so that necessary formalities like paying the charges Making of admission records could be completed. Management structure. This may vary considerably among hospitals. In larger hospitals, the medical director or the medical superintendent may be directly in charge of outpatient department. He may have assistants in various units or clinics reporting to him. In smaller hospitals, there may be a coordinator to coordinate the work of various units of the department reporting to the medical director or the medical superintendent. The nursing side of the OPD should be the responsibility of a well-qualified and experienced nurse whose primary function should be to see that the work in the various clinics proceeds smoothly. She will direct the activities of the nurses and ancillary personnel who work in the department. Flowchart 1.1 OPD process. Look at the screen. 1.6 Monitoring and evaluation. Outpatient services. The quality of outpatient services needs to be monitored and evaluated on an ongoing basis so that areas requiring attention for improvement could be identified and efforts made for improvement of quality of patient care. For this purpose, data need to be collected, compiled, collated, analyzed, and acted upon on a regular basis by a nodal officer in the hospital. The various data that may be needed for such a process are as follows. I. Volume. A. Clinic, department visits statistics of new and repeat visits on monthly and yearly basis. B. Percent changes in new and repeat visits over years in relation to availability of doctors and registration staff. C. Fluctuation in visits by days of the week or month, average, high, low. D. Determine adequacy and utilization of clinics from clinic schedule of preceding year to determine number of hours the clinic was in session. Multiply number of session hours by number of rooms to arrive at number of scheduled hours. And divide this by number of patients seen or average service time to evaluate adequacy of rooms. Further, by estimating actual room hours scheduled and dividing by potential room hours, it is possible to determine the clinic efficiency rate. 2. Utilization and vital statistics. The number of people who account for total annual visit volume determines utilization. Average number of visits per person per year. This figure should be broken down by vital statistics of the population, age and sex. Such information helps in deciding staffing, programming and planning etc. 3. Visit levels. New appointments, walk-in, scheduled, short follows-ups, annual physical examinations, well baby, well child checkup, immunization and complex treatments indicate whether utilizations, staffing, distribution, and amount of revenues need to be changed or kept at the same level. IV. Cost and revenues. The cost of each service should be matched with revenues from respective service. As far as possible, each service should be self-supporting, else cross-subsidy system be developed. Direct patient care costs like salaries, cost of supplies consumed as well as indirect patient care costs like utilities, free care should be calculated. 1.7 Summary. In this unit you have learned that outpatient services are an important component of clinical services in a hospital. You have learned the functions and types of outpatient services. You have also learned how one can plan physical facilities, equipment, and staff in an effective way in outpatient department. Further, you have learned how problems of overcrowding, long waiting time, structural organization, policies, procedures and public relations could be tackled. You have also learned the methods of monitoring and evaluation of outpatient services and how patient satisfaction from outpatient services could be obtained. Thank you for watching. We will see you in the next video with the next chapter.